Welcome back to part 2 of our mini menopause series. In part 1, I explored what is menopause, the side effects and the long-term consequences. We also explored that menopause symptoms can begin years before the actual menopause happens, in a period known as perimenopause. In this part, I'll be looking at what you can do to manage the symptoms of menopause. I'll be looking at hormone replacement therapy and the risks and benefits of it. And in part 3, I'll be looking at some lifestyle choices that could impact your menopause. If you are enjoying this series, don't forget to subscribe to our channel and hit that bell so you're notified when we release part 3. So, what can you do? For many illnesses and diseases, I would suggest that prevention is nearly always better than cure. However, in this instance, there is no prevention. Menopause is as inevitable as having to pay taxes. If you suspect that you may be experiencing perimenopausal symptoms, then your first port of call should be your usual healthcare provider. Many GP practices have access to dedicated specialist menopause nurses who are trained to identify symptoms and provide both advice and support. Do remember that there is no definitive test for perimenopause. You and your healthcare provider may need to rule out other potential causes of your symptoms first. Keeping a diary noting your physical and emotional symptoms could help this process along. It is also worth noting that around 1 in 5 women will not experience any notable perimenopause symptoms. The only real sign that they may identify is irregular periods. Now, it is of course still wise to talk to your healthcare provider in this instance. Changes to the menstrual cycle should always be noted and investigated. So whilst 1 in 5 women appears to have no symptoms, and some women may only experience manageable symptoms, 1 in 5 women experience significant and extreme symptoms, symptoms that impact day-to-day life. It is not unusual for some women to consider giving up work or hobbies because their symptoms are so severe. There is support available, and talking to your healthcare provider is the first port of call. But one option that your healthcare provider may suggest is HRT. So HRT, also known as hormone replacement therapy, or it may be referred to as menopause hormone treatment, is the only real way to deal with the hormone deficiency. Remember, menopause is essentially a hormone deficiency, like other hormone deficiencies, such as thyroid deficiency. If your thyroid gland didn't produce enough hormones, you would consider taking thyroxine to replace it. HRT, or menopause hormone replacement, works in the same way. Now, HRT has had a controversial history. Almost 20 years ago, it was suggested that HRT could increase the risk of developing breast cancer. However, the evidence does suggest that the benefits of using some form of hormone replacement far outweigh the risks that may occur from being deficient in estrogen. HRT may prevent many of the health risks that are associated with hormone deficiencies that we looked at in part 1. There are many different types and forms of hormone replacement available, so there may be a form that suits you better than another. So, for instance, tablets. Now, tablets are probably the most common way that HRT is taken. They're available as either estrogen only or a combination of estrogen and progesterone. This form does present the most significant health risk, a potential to develop blood clots, although that risk is still considered to be negligible. Hormone replacement skin patches are also available. Just like tablets, they're available as estrogen only or combination of estrogen and progesterone. They're like a large plaster that you pop onto your skin for about 3 days and then replace. Plasters do have a lower risk of side effects compared to tablets, and they're really convenient to use. Hormone replacement implants are also available. These are smallish pellets that are placed under the skin and slowly release estrogen over several months. Now, because it only needs to be replaced every few months, it's very convenient, but it is a little bit painful having that implant inserted. And there are also creams and gels available, and these are without a doubt the safest option. So there's an estrogen gel that can be rubbed into the skin to replenish estrogen. And there are also vaginal gels available. Now, vaginal gels are beneficial for vaginal dryness, but they may not relieve other symptoms such as hot flushes. Now, it should be noted that with all forms of HRT, that there can be side effects. However, these generally pass within a few months of beginning treatment. And for many women, the side effects of HRT are not as bad as the symptoms of being perimenopausal. HRT is suitable for most women. As mentioned, there were previously concerns that HRT could cause some types of cancer. This has been pretty much debunked. However, there are still concerns that it shouldn't be used in cases of estrogen receptive cancers. And while we're talking about HRT, one more thing that I want to dispel. HRT is not made from horse urine or any other urine for that matter. This is an urban myth. HRT is sourced from plants, typically yams. No urine is involved. If HRT is something that you want to consider, then you will need to talk to your healthcare provider in the first instance. There are a lot of options out there, and you may need to try more than one type before you find the one that suits you best. And remember, everyone is different, and how you choose to manage your menopause is entirely your choice. What's right for one person isn't going to be right for everyone. In the description under this video, I will put links to resources if you would like any further information. And don't forget to subscribe to our channel and press the bell so you're alerted when we release part 3. And in part 3, I'll be looking at some of the lifestyle choices that could impact your menopause.